Okay, my name is Bethany. I'm an FNP student at UCCS, and this is Brad. I'm going to do an assessment on him. Before he entered the exam room, I did a visual acuity test utilizing the Snellen chart. It was a 20 out of 20 vision. That tested far vision. I did utilize the Jaeger card for near vision. He was a 14 out of 14. Also, a mental status exam was performed. His gait and station was normal. His posture is upright. No spontaneous movements. His behavior was appropriate. He's well groomed, dressed appropriately for the situation. Cognition is intact. Tested through the serial 7s. His recent memory is intact. He could recall what he ate last night for dinner, and his remote memory is intact. He could tell me his mother's maiden name. Thought processes are alert. No delusions, speech is clear, he's articulate, and no word searching. He's alert and oriented to person, place, and situation. So we're just going to begin by looking at the color and of his skin. I don't see any obvious lesions. His skin is pink, no evidence of cyanosis or jaundice. We do see, I just said you had macules on your shoulders. And there's a papular lesion on his neck, because I know that will be on the video. Color on inspection of his fingernails. He is well groomed. They are firm. They're smooth. Cap refill is less than 2 seconds, so it's brisk. Go ahead and put your fingers together. And I can see that the angle of the nails is less than or equal to 160 degrees. Going back to his head, he's normocephalic. He holds it upright. His hair is brown. It's fine. Evidence of alopecia. Scalp, I see no masses or lesions. So I'm going to go ahead and palpate your head if you don't mind. Any tenderness? No tenderness. We're going to palpate the temporal artery. I feel that it's 2+ and symmetric, and there's no ropiness. So we're going to do a few tests. Right now we'll do the facial sensation test. This is cranial nerve number 5. I am going to tell me, close your eyes, tell me if you can feel this and where.
Above my right eye.
Good, so this is a test of the trigeminal nerve, cranial nerve number 5, and that's ophthalmic branch.
Below my right eye.
Okay, so that's the maxillary branch.
My right cheek.
And let's do chin.
My right chin. Right
So-
up my chin.
That is the mandibular branch. So cranial nerve number 5 is intact. We're going to go ahead and do a corneal reflex. So this is actually, we're just talking to you, this is going to poke the corner of your eye. I'm not really going to do it, but just blink. And corneal reflex is intact, and that is cranial nerve number 5 for the sensory portion and 7 for the closure. Go ahead and smile for me, puff out your cheeks, and wrinkle your forehead. And again, that's cranial nerve number 7. So we're going to move on now to the ears. On external inspection, I don't see any masses or lesions. The pinna crosses the eye occiput. The vertical angle is less than 10 degrees. No, we're just seeing on the right side, sorry. And then I'm going to go ahead and palpate. Any tenderness?
No.
This is the pinna, the tragus, any tenderness?
No.
And the mastoid, any tenderness?
No.
And I don't feel any masses. So upon internal exam, the canal is free of cerumen or debris. I see the elbow, the short process of the malleus, the manubrium, the pars tensa, the pars placida, and I cannot see the incus or the annulus. We're going to go ahead and do a few tests on your ear. the whisper test, go ahead and cover your left ear, and I'm going to whisper letters and numbers, and tell me if you can hear them.
A, 8, B, C, 5, X.
Good. So the whisper test tested the acoustic nerve, cranial nerve number 8, and that is intact. And then, more tests. So we're going to use this guy here, and we're going to test cranial nerve number 8 for the Weber test. Can you hear this?
No. Yes.
Can you hear it equally in both ears?
I believe
Yes.
so,
Just
yes.
say yes. Don't say that. Yes. Okay, so there's no lateralization. And then, can you hear this? Say yes.
Yes.
This is the Rhine test. And tell me when it stops. And wait like 5 seconds.
Just stop.
Can you hear this?
Yes.
And tell me when it stops. And then this should be like 2.5 seconds.
It's still going.
Just say it stops.
Stopped.
Okay, so the Rhine test is, otherwise it takes like 30 to 45 seconds.
Are you going to do it the full 30 or
No.
45 though?
No, because she didn't either.
Or can you like hold
So
it up
wait.
there and then pull it away or something? And it's-
Oh, to tell you when?
Yeah.
Okay, so this is the Rhine test. So then, tell me when it stops. You can hear it, right?
Mhm.
Just say yes.
Yes.
Tell me when it stops.
It stopped.
Can you hear it? Yeah.
Yes.
And then tell me when it stops. So then wait like 5 seconds.
It stopped.
Okay. So the Rhine test is intact. And air connection is greater than bone connection. The ratio is 2 to 1. So we're going to move on to your eyes. I noticed that your eyebrows and your eyelashes are free of infestations. They are intact. The eye spacing appears even. The lid is actively opening and closing. Opening is cranial nerve number 3. Closing is cranial nerve number 7. So I'm going to get a light. Stop. And I notice the sclera is white, the cornea is clear, the iris is brown, the pupils are equal bilaterally, and I'm just going to pull down your lower lid here. The palpebral is clear with a few vessels. Is that the right one? Oh, the bulbar conjunctiva is clear with a few vessels, and the palpebral is pink, no evidence of cobblestoning. So I'm going to go ahead and palpate the lacrimal gland. Any tenderness?
No.
And the lacrimal sac. Any tenderness?
No.
No tenderness. So we're going to do a bunch of tests. The first one is the Hirschberg test, and this tests eye muscle alignment. When I shine the light in his eyes, I notice that the light reflex is equal in both eyes. We're going to go ahead and do a cover-uncover test, and this also tests eye muscle alignment. If you could hold this up to your right eye, and I am going to, this is cover-uncover near and far, so we're going to cover the right eye and look for movement in the left eye. And don't be goofy. And then go ahead and uncover your right eye, and I'm going to look for movement in the right eye, and I don't see movement in either eye. So then the pupil response, we're going to do a direct, and this is cranial nerve number 2 and 3, and as I shine the light into the left eye, direct, that's the pupil constricts. Good, so now I'll be looking into the right eye, shining into the left, and there is consensual, which is cranial nerve number 3. So for accommodation near and far, as you look at the wall, go ahead and look at this spot at the wall. His pupils are relaxed. And if you look at my finger, your pupils constrict. So this is Near far is cranial nerve number 3. And then as we accommodate and go in, there you go, that's cranial nerve number 4. So visual fields by confrontation, go ahead and hold that cover over the right eye. And as I wiggle my fingers, when they come into view, let me know.
I see him.
Just look forward.
I see him.
Stop.
I see him.
Look forward. You're looking to the left.
Look behind you, so I'm
I
not looking at
can't.
your
I
arm.
have to be up here.
Okay.
So when you see me like here, say yes.
Yes. I see it.
Please stop.
I'm not
Just-
screwing with you.
I know, but just like pretend, okay?
Yes.
So that's 90 degrees temporally,
Yes.
50 degrees superiorly,
Yes.
60 degrees medially,
Yes.
and 70 degrees inferiorly. Thank you. So that's the visual fields by confrontation. Now we check the 6 cardinal fields of gaze. If you could just look at my finger, and as we move, his eyes move, I'll tell you which cranial nerve we're testing. So laterally, that's cranial nerve number 6, cranial nerve number 3, cranial nerve number 3, and cranial nerve number 4. Okay, so we're just going to then do a fundoscopic exam, which is a direct visualization of cranial nerve number 2. So I'm going to set my diopter at 0. And as I look at the eye, I see the red reflex, a portion of the optic disc, and 1 or 2 vessels. We're going to move on now to the nose and sinuses. Looking at his nose, it is midline. No deformities. The skin tone is consistent. Let me see if I can see your deformity in the camera. No.
I would just mention a slight deformity on the left side.
Because then I have to talk to you about it and ask you what happened and... Okay, so it's midline, skin tone is consistent, no deformities. Go ahead and we're going to test his patency. Can you block your left nostril and do a sniff in? No. Do this. That's rude to stick your finger up your nose. Okay, so he demonstrates patency. I'm going to go ahead and palpate any tenderness.
No.
Okay. And we're going to go ahead and palpate the maxillary sinuses. No. The frontal sinuses and the maxillary sinuses. Is that the other way around? No, it's got to be frontal and maxillary. Any tenderness?
No.
Okay, so on internal exam, I can do this. The septum is midline. I don't see any deviation. The nasal mucosa is pink, moist, and I don't even visualize the inferior turbinate, let alone the middle one. Okay, so we're going to test your olfactory, which is cranial nerve number 1. Go ahead and occlude your left nostril again. Yep, and tell me what you smell.
Cinnamon.
Okay, so cranial nerve number 1 is intact. We're going to move on now to the mouth and throat. As I look at your lips, I don't see any lesions. They're nice and pink. They don't look dry, no dryness. As we open the mouth, we can notice that the frenulum is intact on the upper and the lower. The gingiva is pink. It's adherent to each tooth. I can see his teeth, no cavities, normal dentition. As I look at the buccal mucosa, it's pink, it's moist. I notice the Stinson's duct up at the second molar on the upper side. The hard and soft palate is intact. That's what I need is a tongue depressor. Hard and soft palate is intact. Good. And go ahead and stick out your tongue for me. I notice the papilla is normal, and I can see the Stinson's duct on either side of the frenulum. Go ahead and stick it out again. I don't see any lesions, and move it side to side. That's cranial nerve number 12. And as I look in there still, I notice the posterior pharynx. Okay, and then the tonsillar region, I notice, go ahead and stick out your tongue. Some redness, and we're going to do gag reflex. Oof. And the gag reflex is cranial nerve number 10. I don't think I have that on here. Oh, you know what? I forgot. Okay, so go ahead and do the, say ah.
Ah.
So the uvula elevates with phonation, which is cranial nerve number 9. And then the gag reflex is intact, which is cranial nerve number 10. So while we're here, we're going to do a taste. And if you could tell me, stick out your tongue and tell me what this is. Sugar.
Sugar.
So I'm going to need sugar and
I need to take a sip of water.
tongue probe. Yeah, we're going to do some water too.
Do me a favor and just walk to the camera and make sure it's still recording. Should say REC.
Yeah. Okay, so go ahead and say light, tight, and dynamite.
Light, tight, and dynamite.
Good, that's cranial nerve number 12. And as you open your mouth, don't let me close it. Good, this is the TMJ. It's nice and strong. And move your jaw from side to side and then against resistance. Good TMJ strength, you're 5 out of 5. And go ahead and clench your teeth. That's cranial nerve number 5. And what's range of motion, vertical and lateral? Okay, so now we're gonna test on your neck. This is all out of order. That's what I'm getting confused. Okay, and then go ahead and swallow go ahead and just swallow a sip of water for me. That's cranial nerve number 10. And then take a sip and hold it in your mouth. And push your thyroid to the side. Good. Go ahead and swallow. Good. And then one more time. Do the same thing. Just hold it in your mouth. And go ahead and swallow. Good. And I don't feel any masses. And that's cranial nerve number 10. I'm also going to palpate the carotid artery and take a deep breath and hold it. And while I'm here, I'm going to auscultate the carotid. Oh, you can let it go, sorry. I'm going to auscultate with the bell of my stethoscope. And the trachea also. For cranial nerve number 11, go ahead and shrug your shoulders for me. Move your head from side to side. Good. And then do a lateral rotation, bend. Yeah. Okay, just a bend. Sorry. I said rotation, but not bend. And then do it against resistance. Good. Not good strength. Okay. And then while we're here, we're going to palpate your lymph nodes. So we have the preauricular lymph nodes, the postauricular on the mastoid, the occipital on the occiput, the posterior cervical chain, the anterior superficial deep and cervical chain, the tonsillar, the submandibular, the submental, the supraclavicular, and the infraclavicular. Any tenderness?
No.
We're going to move on to thorax and lungs. As I look at your chest, We're gonna have to take off your shirt. Can you take off your shirt? I noticed that the respiratory effort rate is even, unlabored, no use of accessory muscles. And we're actually gonna have to turn around. The spine, just sit sideways. Yeah, perfect. The spine is normal curvature of the cervical, thoracic, and lumbar spine. It is midline. The angle of the ribs is a normal slope. It's less sloping downward, an angle less than 45 degrees. The scapula, I don't notice any winging. Go ahead and hold your arms just like this. There, just like that. So scapula, I don't notice any winging. As I come to the anterior chest, the costal angle is less than 90 degrees, and I don't see any external deformities. We're going to move on. Palpate. You can go ahead and put your hands down. The chest, I don't feel any lumps or tenderness. For respiratory excursion, we're going to watch how your chest expands. Go ahead and take a deep breath. Good respiratory excursion. So I'm still palpating. We're going to do tactile firmness. So as I say, you say 99, I'm going to use the side of my hand and say 99.
99.
Keep going.
99. 99. 99. 99. 99. 99.
And I notice very minimal tactile firmness between the scapula and very diminished down in the periphery. I'm going to percuss all the fields. And expect to hear resonance in all the fields here. I should do this. Okay. And for diaphragmatic excursion, go ahead and take a deep breath in and hold it. So there's the bottom, and I would draw a line. And then breathe it out. Take another deep breath in and blow it all out. Keep it out. So the diaphragmatic excursion is about anywhere from 3 to 5 centimeters, and his is about 5 centimeters. While I'm here, I'm going to test for CVA tenderness over the kidneys. Any pain?
No.
Okay.
No.
So I'm going to auscultate now for breath sounds. On the posterior chest, I would expect to hear bronchial. No, yes, bronchial up at the apices, bronchiovesicular between the scapula, and vesicular in the periphery. I would use the diaphragm and the bell of my stethoscope. And then I'm just going to go really fast for the sake of the video. And so then that's with the bell, and then I'm going to check the right middle lobe, mid-axillary. Take a deep breath for me. The diaphragm and the bell. Good. And that all sounded normal to me. For the cardiovascular exam, we're going to check the chest. Go ahead and turn all the way around, or 180. I don't see any abnormal pulsations in the anterior chest. I do see scattered, I don't know what they're called. They're not lesions. I'll have to look it up. They have a special name.
Zits.
The contour of the chest is normal. I don't see any pulsations. And really I don't visualize a vascular pattern. We're going to palpate for the PMI, which is the 5th intercostal space, mid-clavicular. It is non-displaced, no lifts, heaves, or thrills. We're going to auscultate in 2 positions while you're sitting and while you're lying down, both with the bell and the diaphragm. So for the heart rate and rhythm, let's listen. I expect it to be regular rhythm with no extra cardiac sounds. The first place I'm going to listen is the aortic, which is the second intercostal space right of the sternum. The second is the pulmonic, the second intercostal space left of the sternum. The third is the erbs. Third is the left of the sternum, third intercostal space. The tricuspid is the fourth intercostal space left of the sternum, and the fifth is the mitral, fifth intercostal space left, mid-clavicular. And then as I listen with the bell in the same exact places, I hear the S2, it's loudest at the base of the heart. And S1 is loudest at the apex of the heart. So we're going to have you lie down. So technically he's lying down. I would do the same exact assessment with the diaphragm and the bell. Let me say this all together. The aortic is the second intercostal space right of the sternum. The pulmonic is the second intercostal space left of the sternum. The erbs is the third intercostal space left of the sternum. The tricuspid is the fourth intercostal space left of the sternum, and the mitral is the fifth intercostal space, mid-clavicular. So we're going to move on to peripheral pulses. We already did temporal. I'll do brachial. It's nice and strong, even 2+. While I'm here, I'm going to check the epitrochlear node. Go ahead, just relax. Any tenderness? The radial, 2+. Femoral, because you're lying down, 2+. While I'm here, we're going to check your inguinal nodes, the vertical and the horizontal. Any tenderness?
No.
I don't feel them. Popliteal, just relax your leg. Good. Posterior tibial, and the dorsalis pedis. Good. Okay, so moving on to your abdomen. Well, yes, but you're fine. No, it's not. You're getting a little ab workout.
A fat workout?
The appearance, I do notice a few striae, which I don't just like to say another word. The shape is a little rounded. I don't see any pulsations or that doesn't help, or vesicular patterns. The umbilicus is inverted. I don't see any hernias, scars, or bulges. So I'm going to auscultate for bowel sounds in all 4 quadrants. I would expect to hear normal active, some gurgling, and using the bell of my stethoscope, I'm going to listen for the aorta. The renal. The iliac. And the femoral. And I'll have to look up how to describe those. So on palpation, which is really only 1 to 2 centimeters deep, are you having any tenderness?
No.
I don't, no superficial masses, no lateral pulsations of the aorta. So on deep palpation, you have to relax. But yes, I'll be doing deep palpation. We're going to try and get the liver. Did not palpate that. And the spleen. Did not appreciate it. And we'll do a bimanual of the kidneys. Any tenderness?
No.
Okay. On percussion, I would expect to hear timpani throughout. And when you check the liver span here, we will go from bottom up. We'll go from Tiffany to Dole. Right there, mark that area. And then from Resonance to Dole, mark that area. And I would expect it to be anywhere from 6 to 12 centimeters. And he's about 8. Okay. The spleen is on the 9th to 11th mid-axillary, and I cannot hear any dullness. So as he's still lying down, we're going to test for the superficial abdominal reflex. And the upper is T8 through 10, and then the lower is T11 through 12. Yeah, and no muscle contraction at all. So just looking at his extremities, the color is normal, they look symmetric, his muscular features look symmetric. We're going to palpate the joints, your spine, muscle mass, strength, toenails, capillary refill. Everything looks good on palpation. Now we're going to do some range of motion, active and against resistance. So range of motion on your shoulders, go ahead and stand. No, sitting's fine. Just do extension is just relaxed. Extension, flexion, hyperextension. Good. And then come back. And then abduction, adduction. And kind of fold your arms here and internal or external rotation. So kind of like angle your shoulders out. Good. And then internal rotation, bring them in. Good. And then we'll do it against resistance. So extension and then flexion, come up. Good. And then go back. He's got strong, do the same, all the motions. Adduction. Good. And then abduction. Good. And then internal and external rotation. Good. Good strength, 5 out of 5 strength. We're going to do range of motion of your elbows. So we've got neutral position extension here. And then go ahead and do flexion with your palms up. Both hands up. And then pull it down. And that's supination. And then pronation. Good. And then we'll do that against resistance because this is just for your elbows. So go ahead and do the same motions again. Up, good, down, against resistance, like equal. And then supination, pronation against resistance. Good. Good. Okay, so for your wrists and fingers, neutral is extension. Go ahead and flex down just for your wrist. And then hyperextension up. And then which? Ulnar is in and then radial is out, the deviation. Yeah. And then fingers, go ahead and spread your fingers. Make a fist for abduction. And then let's test the strength of your fingers. Go ahead and put them together like this and don't let me pull them apart. Don't let me pull apart. Let me pull apart. And let me pull apart. And then wrist, go ahead and push up. Down. Good. And we did elbow, right? Okay, so 5 out of 5 on strength. And then for hips, we're going to do extension as our neutral position. And then go ahead and do, you can lay down or stand up, however, I'm standing up. Abduction, out towards me, push your leg out towards me. Oh, I'm not doing strength first, so just can you make that movement? Abduction and then back in is adduction and cross over. Good. And internal and external rotation, so you can kind of bend at the knee and externally rotate and then internally rotate. Good. And then we'll do that against resistance. Just push out towards me and then go in and then externally rotate. Good. And then internally rotate. Good. So 5 out of 5 strength. For knees, we're in neutral position right here. That's flexion, extension, and then do that against resistance, and that would be a 5 out of 5. Good. So for ankles and toes, so your foot is in neutral like that, and then do dorsiflexion up, plantar flexion down. Eversion is out, twisted out, good, and then inversion is twisted in, good. And then flexion of your toes, can you curl your toes? Good, and then extension and hyperextension of your toes, good. And so let's do all that against resistance.
Dorsum. Inversion. Eversion.
And see the toes.
Flexion.
Good, 5 out of 5 strength. So for your spine, go ahead and do, go ahead and lean forward. Flexion is neutral. Yeah. Is it flexion? Extension is neutral.
This is flexed.
That is flexion. Go ahead and stand up and then lean back. So that would be a bit of a hyperextension. And then we want a rotation. So with your waist, not your hips. Good. So you're going to do laterally, and then can you bend? A lateral bend. Good, so we'll do all that against resistance too. So come up, go down, come up, and then rotate.
I need to hold my shoulders.
Well, then that will be testing your shoulders.
Well, I'm turning
Okay,
this way.
so neurological, go ahead and sit back down. We're going to do a finger to nose. Touch your nose, touch my finger. Good.
I'm just touching your finger.
That's finger to nose. Oh, just do this. That's finger to nose. And then finger to my finger. And then for the lower portion, go ahead and slide your heel along your shin. Good. And then we're going to do rapid arm movement. So flip your hands in and out. Good. So for your walking, go ahead and stand up. We're going to walk on your toes. Okay, and then come back walking on your heels. And then do just a normal walk for me. And then we're going to test your romper. Don't go far. And just stand here, close your eyes. And I don't notice any listing. And you can sit back down. So that was, now we need to test your sensory function, the spinal thalamic tract. Go ahead and close your eyes. I'm going to touch your skin with a cotton ball. And this is my sharp or dull. And tell me if this is sharp. Okay, so this is dull, and this is sharp. So tell me what this is.
Dull. Dull. Sharp. Dull. 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 Sharp.
Good. And then the posterior column, go ahead and close your eyes, keep them closed. I'm gonna put something on your foot. Oh, I need to do it on your wrist too. Tell me what it is. And if you can feel it, it's just supposed to be vibration. Can you feel that?
Yes.
What is it?
Cold metal. Vibration.
Vibration. Tell me when it stops.
Stop. Vibration.
Tell me when it stops.
Stop.
Good. So keep your eyes closed. I'm going to hold your hand out. So this is up, this is down. Tell me which way I move something.
Up. Down. Down.
Good, so he's got
Up.
good position, sensation. So keep your eyes closed. I'm going to put something in your hand and tell me what it is.
Paperclip.
Okay. And what is that?
Quarter.
So he's got good stereognosis. And I'm going to draw something in your hand. Tell me what number it is.
30.
Good, so he's got graphesthesia. First, deep, you can open your eyes now. Deep tendon reflex, we're going to test the patellar.
I missed it. You're too low.
so that's his patellar. Okay, so it's brisk. Just relax your arm. Damn. Just make your arm out. This is the tricep. Woo! I got it! Okay, and then so this is relax your arm. How am I supposed to do this? Good. Good. The bicep.
Feel the nerves.
And then that's the brachioradialis. And then for the Achilles, I'm actually going to put your foot flat. Good. Good reflexes. So then my last reflex is the superficial reflex of the plantar, testing L4 through S2, and he should flare his toes and his toes, but yes, he did. Thank you, Bradley, for your exam.
That was only 30 minutes.
How do you stop it?